Right, Bismillah ar-Rahman ar-Rahim. Uh, Chapter 10, Reproductive and Gender Issues. In this chapter, we will discuss 8 things. Number one, about sexual intercourse, with whom it is permissible, with whom it is not. Number two, we'll talk about genetic diseases. Number three, we'll talk about artificial insemination. Number four, we'll talk about abortion. Number five, we are going to talk about uh, finding and deciding the gender of the unborn child, the fetus. Number six, we'll talk about family planning and birth control. Number seven, we'll talk about the surgeries involving sexual change or sexual orientation correction. And lastly, we'll talk about uh, other forms of surgeries related to the broader scope of the chapter. So, first discussion on sexual intercourse. We know that it is permissible for a husband to derive pleasure from his wife, however it wants, except, of course, penetration during her periods and postnatal bleeding, as well as having anal intercourse, which is completely haram. And even in her menstruation or her nifas, he can still like do everything other than penetration. So cuddling and touching and fondling, all of these things would be permissible, right? And so we know during haze it is haram for them to have intercourse. Allah subhanahu wa ta'ala mentions in the Quran, Surah Al-Baqarah, وَيَسْأَلُونَكَ عَنِ الْحَيْضِ. They ask you about menstruation. قل هو أذى فاعتزلوا النساء في المحيض ولا تقربوهن حتى يطهرن. Uh, say it is harm, so keep away from wife during menstruation and do not approach them until they are pure. By not approaching them means intercourse, as the hadith in the next part explains it further. فَإِذَا تَطَهَّرْنَ فَأْتُوهُنَّ مِنْ حَيْثُ أَمَرَكُمُ اللَّهُ. And once they become pure, then come to them uh, from wherever Allah has ordered. إِنَّ اللَّهَ يُحِبُّ التَّوَّابِينَ وَيُحِبُّ الْمُتَطَهِّرِينَ. Allah loves those who are constantly repentant, and Allah loves those who purify themselves. In the hadith of Anas ibn Malik, radiallahu anhu, and this hadith is mentioned in Sahih Muslim, he reports that the Jews of Medina, whenever a woman amongst them menstruated, they did not eat with her, they did not mingle with her within their houses. And the hal of mushrikeen of Makkah was even worse. They would kick them out of the houses. They had built special places, special rooms. Whenever a woman was in her menstruation, they would send her over there and she would remain there. Right? So when asked about this situation, the Prophet said, actually, the ayah was removed, and they ask you about menstruation, say it is harm, so keep away from the wives. And the Prophet made the tashri of this that do everything other than copulation, right? So you're not going to treat them as second-class citizens or anything like that. It is for your benefit, for her benefit, for the benefit of your children that you do not have population intercourse in this period. Other than that, live a loving life. Imam Nawawi rahimahullah ta'ala, he says that there is a scholarly consensus in ijma on the prohibition of this al-ityan bil mahis. And as far as anal intercourse is concerned, uh, that is also forbidden, as we know. One dalail is the Quran itself, Surah Al-Baqarah, the previous verse. فَإِذَا تَطَهَّرْنَ فَأْتُوهُنَّ مِنْ حَيْثُ أَمَرَكُمُ اللَّهُ. And when they have purified, then come to them from where Allah has ordained to. مِنْ حَيْثُ أَمَرَكُمُ اللَّهُ, where Allah has ordained. And what is that? That implies to the front entrance, the vagina, right? And this is also suggested by another verse of the Quran. Uh, Allah subhanahu wa ta'ala mentions the same surah, Surah Al-Baqarah, نِسَاؤُكُمْ حَرْثٌ لَكُمْ فَأْتُوا حَرْثَكُمْ أَنَّ شِئْتُمْ, that your wives are a place of sowing, telling us the purpose of intercourse in marriage. One of the purposes is bearing children. And you can only do that if you are having intercourse in the proper fashion. You can't get that from intercourse. So this verse also tells us that the place Allah has ordained is from where you can actually bear children. And Abu Hurairah radiallahu anhu, he makes a mention of a hadith that the Prophet ﷺ mentioned, and this hadith is available in Sunan Abi Dawud. مَلْعُونٌ مَنْ أَتَى إِمْرَأَتَهُ فِي دُبُرِهَا. That first is the one who has intercourse with a woman in her posterior. Now there's this thing called spooning, in which there's anal penetration doesn't take place, but the male genitalia is rubbed off against the posterior of a female. So obviously, if this happened with husband and wife, this is something that is not forbidden by Shara. So if a married couple will want to do that, it's totally fine. And second discussion is about inherited diseases. So we'll talk about firstly about premarital genetic screening. So what is the hukum of it? Is this farz wajib, mubah, mustahab, or is it completely forbidden? Well, as far as premarital screening is concerned, what it's actually a panel of tests that is carried out on a couple when they're planning to get married. Now, before they get married, they have this screening to assure that they are fit, especially if they want to have children. But sometimes diseases like AIDS, they have nothing to do with children. And if your marriage is not out of convenience and you actually want to get married, then this could actually be sometimes a good thing to do. So the goal is to ensure that neither of the prospective spouses have any prevalent diseases that would pose a risk to their partner or any offspring that results from this marriage. Right? Now, what is the hukum? It is permissible and it is consistent with the maqasid of Sharia, right? Because the Sharia considers this because there's welfare for the society at large. And so Allah subhanahu wa ta'ala, he mentioned in the Quran, هنالك دعا زكريا ربه قال رب هب لي من لدنك ذرية طيبة إنك سميع الدعاء. Surah Al Imran. And Zakaria alayhi salam called upon his Lord, saying, my Lord, grant me from yourself a good offspring. Indeed, you are the hearer of supplications. And in Surah Al-Furqan, Allah subhanahu wa ta'ala mentions, وَالَّذِينَ يَقُولُونَ رَبَّنَا هَبْ لَنَا مِنْ أَزْوَاجِنَا وَذُرِّيَّاتِنَا قُرَّةَ أَعْيُنٍ وَاجْعَلْنَا لِلْمُتَّقِينَ إِمَامًا. Uh, and those who say, "Oh, our Lord, grant us from among our wives and offspring comfort to our eyes and make us an example for the righteousness." Now, the first word indicates that the prophets themselves, peace be upon them, prayed Allah to bless them with a good offspring, right? A good offspring. And the second verse indicates the believers supplicate to Allah to grant them comfort through their spousal offspring, some comfort. Now imagine the difficulty in the life of the parents having a child who is genetically diseased. You know, if they, for example, have Down syndrome, right? If their mental capacity has not been fully established, or if they are physically disabled, they have a missing limb, right? So it's not very easy. It's not easy for parents. Some take it on as a challenge and embrace it, and they do a very good job. Uh, most just get by. So the idea of a good offspring, the offspring that will be comfort in our eyes, you really can't achieve that when your child is deformed or is has a genetic illness. This is not to say that the parents don't love their children. They might love them more than their other children, but doesn't really give them the peace of mind, doesn't really give them that that uh, cooling of the eyes, right? That is about the comfort of the eyes. Obviously, you won't say that it is good. It's a challenge. Even for the child, it is a challenge. For you as parents, it's a challenge. So you can't really classify it as good offspring, at least in the material sense. So these du'as, the idea of the believers and the idea of the Prophet tells us that on our part, we should try and achieve uh, children who will be healthy. Okay? Then you have the fiqh maxim, al-qaida al-fiqhiyya, which says al-zararu yuzal, that harm must be removed. And refraining from conducting premarital genetic screening could prove harmful to the offspring in cases where the parents are carriers of abnormal genes, because such genes may be inherited by the offspring, resulting in a corresponding genetic disorder. And the purpose of PGS is to ensure that neither potential parent is a carrier of any of those common genetic diseases, and therefore it is permissible in the interest of warding off this harm. Thirdly, PGS serves the goal of protecting the lineage and offspring, and as you know, Hifzul Nafl is one of the maqasid of Sharia, right? And there are many sacred texts that attest to this, to the importance of uh, preventing harm or destruction. And so awareness of the genetic status of the prospective father or the prospective mother can contribute to this aspect of protecting the lineage, as it would likely reduce the chances of getting genetic diseases, since some of the diseases can be prevented or their effects underway in advance. Imam Ghazali writes that the objectives of Sharia regarding creation are five: preserve religion, life, mind, lineage, and property. And thus, everything that entails preserving these five fundamentals is considered a maslaha, a welfare, and correspondingly, anything that results in the loss of these fundamentals is considered mafsada, a source of damage. And eliminating the mafsada is a maslaha, right? Fourthly, you have it is an obligation to avert harm before it occurs in preventative measures using all possible means, because prevention is better than cure. And this is implied by the other fifth maxims. الضرر يزال بقدر الإمكان. And درء المفاسد أولى من جلب المنافع. Warding off a harm, a detriment, takes precedence over bringing about benefits. Right? So it's mubah to get premarital genetics screening, but if one of the potential spouses is a potential carrier of a deformed gene, and you can know this by looking around in your family. If you know there's like a medical condition, a genetic condition that runs in the family, that could be a sign that, you might be a carrier. In this case, it would be mustahab to get premarital genetic screening. Normally mubah, but if we have reason to believe that you might be carrying that gene, then it becomes mustahab. Now, one of the questions is, are cousin marriages allowed? Because there's a notion in the medical community that when you marry off, the closer you are related to your spouse, the higher the chances of uh, a genetic disease, bad genes being given off to the children. What is the reality of this? And what does the Sharia have to say about this? Right? Oh, and before we actually get to that, one more thing is that it is permissible for a government to impose PGS if a particular genetic disease is prevalent in a region. Right? So when something is mubah, the government has some jurisdiction according to the Sharia in navigating through the mubah, so they can make it uh, obligatory by law, and they can forbid it by law as well. Okay? As long as a mubah has not been sanctioned by the Quran or the Hadith, if explicit permission of that is granted by the Quran and Hadith, then the government has no jurisdiction in those matters. But as for those mubah which are not mentioned in the Quran or Sunnah, the government has this jurisdiction of either making it unlawful or making it obligatory and necessary. And this is a very important principle, especially in terms of governing in politics. Willingly, to what extent, there's whole concept of following the law of the land, right? And this is required by the Sharia, and you hear that a lot, especially from media scholars. What I just mentioned to you is one of those boundaries, as to in which extent are you actually allowed, or are you supposed to follow the law of the land? Allah Alaihi Wasallam. Right. A woman's guardian has the right to require that her suitor undergoes PTS if there are indications that he or his future children are likely to be affected by the disease in the future. And remember that this is very different from checking sperm count, fertility. So fertility tests are quite different from tests. So that's actually a very separate issue. Now, back to the question at hand, marriages between close relatives. What does the Sharia have to say about that? Well, we know that the Sharia permits marriage amongst relatives, cousins, right? And we find this explicitly mentioned in the words of Allah subhanahu wa ta'ala in Surah Al-Ahzab. بعد أعوذ بالله من الشيطان الرجيم يا أيها النبي إنا أحللنا لك أزواجك اللاتي آتيت أجورهن وما ملكت يمينك مما أفاء الله عليك وبنات عمك وبنات عماتك وبنات خالك وبنات خالاتك وبنات a prophet we have made lawful to your wives, who you have given the due compensation for mahar, right? And those your right hand possesses. By this means slave girls. Also, Allah has made permissible daughters of your paternal uncles and daughters of your paternal aunts, daughters of your maternal uncles and daughter of your maternal aunts. Permission has been granted, Sharan speaking, right? And by practice also, that the Prophet alayhi salam, he married his first cousin, Zainab bin Jahash, right? And also another example of marriage among relatives that he gave his daughter Fatima uh, in the marriage of his cousin Ali radiallahu anhu, right? So there you have it. The Sharia has put out the hukum, it is permissible. But from a medical perspective, some physicians have warned against such marriages because this may result in genetic disorders in the fetus. There's a slightly increased chance of this, right? So this could potentially lead to low birth weight or other congenital malformations or other physical or mental problems. And as a result, they do not recommend it and warn against it, right? And actually, there is a Za'if hadith which kind of supports this. So the hadith is La, uh, either the word is tankihu or tazawwaju al-qaraba al-qarina. Do not marry very close relatives. So this is a Za'if hadith which is there, out there. Now the problem is about being a Za'if hadith is that when we say that a hadith is Za'if, it means that there's a potential that this may not be from the Prophet alayhi salam. And it's not mentioned in any of the canon books of hadith. So is this actually a hadith? Because it really doesn't seem to fit right with the other word, with the verses that we just mentioned over here. Or was it just given the form of a hadith by people who wanted to stop the Muslim population at that time from doing such an act? So that question still remains. One way to reconcile between that hadith, that is al-wajh al-qaram al-qariba, and these verses of the Quran is to say that the verses of the Quran give permissibility, that you are allowed to get married. But that hadith suggests that even though you're allowed, Allah, it is better off that you don't get married to your close relatives. Allahu a'lam bis-sawab. That is according to one medical opinion. However, there are other distinguished physicians who disagree with this, saying that this practice is not dangerous, and so you should not forbid it. And they've concluded that most often, cousin marriages or consanguineous marriages is not harmful, and the reported percentage of genetic disorders in the fetus is sufficiently low, or what in research we call uh, statistically insignificant. Uh, that it's so low that it's not warrant enough to not warrant neither for prohibition or warning against it, right? So this is generally speaking. However, if it is medically proven that two parties are afflicted with the same genetic disease, that is likely chance that there's a higher risk in the offspring, then obviously we should avoid doing so. Or, for example, if you've seen in your family that a cousin marriage has led to such a problem, then you might want to reconsider the marriage proposal. But again, it's not prohibited. Even though he mentions in the book over here, it may even be prohibited for them to marry in cases where it's most likely that their offspring will suffer from genetic disease. But I don't think it is statistically possible to actually ever reach the condition of most likely because every marriage has a 50-50% chance. Either this will happen or this won't happen, and there's no way around that. So do not think that it could ever be in the case, but again, I'm not a medical professional, so that's one for the doctors to decide. But I feel that it is very difficult for it to ever to reach the condition of reaching the point that you would say that is most likely that his offspring is going to suffer from genetic disease. Allow on myself. All right, so that is number one. Number two, the fuss of nikah because of a genetic disorder, the annulment of a marriage contract. So if either of the spouses has the option to move for annulment of the marriage, if the other spouse is afflicted with a disease that impedes the desired outcome of the marriage, or if they have contracted a viral contagious disease. And similar is the case if the children would be afflicted with a major defect or disease. So Muslim Jews have mentioned that among the defects that permit fasq, uh, several instances of less serious certain diseases, right? Evidence of this is confirmed that Umar radiallahu anhu, he annulled marriages due to white leprosy, al-baras, and mental derangement. And he said, if any man marries a woman who has white leprosy, black leprosy, or mental derangement, without being told of her condition by her guardian, or even the other way around, and they consummate the marriage, then that woman is entitled to all her mahar, and the husband should be compensated by her guardian because he was not informed, and if he was, he probably might have taken a different decision. Right? So genetic diseases are similar to leprosy, and they might even be worse or more serious. Therefore, such genetic diseases are grounds for annulment of marriage. Whether these diseases they were established before marriage contract, or maybe one of the spouses acquired it after the marriage. Nevertheless, if the other healthy couple spouse is aware of the defect and they choose to go forward, once you choose it, you cannot go back. But when you learn of it for the first time, then you get the right for fuss if you want to call it off. But once you accept that condition, then you can go forward. So this is what the FIP suggests. And then the whole moral and iman aspect of the situation, that's another section. Number three, we'll talk about at-talbih as-sinari, assisted reproduction. So the desire for children is a natural tendency, right? And is one of the greatest objectives of marriage. Hence, infertility is a disease for which treatment is religiously recommended because if the objective, one of the objectives of marriage is to get children, then you also want to take measures for infertility, right? And if there is an appropriate medication for that, then there is no objection in using it. If it cannot be treated through medication, but it is possible that assisted reproduction might help. Uh, then there are several options within that broad field of assisted reproduction that might be medicinal, and we'll now talk about some of them. All right, so the first thing that you have uh, is intrauterine insemination. So what happens is that the husband's semen is injected in the appropriate part of the wife's womb or the canal between the uterus and the vulva in order to facilitate internal fertilization of the ovum. So everything is happening internally. It's the wife's eggs, it's the husband's sperms happening in the wife's body. This procedure is permissible, but under certain parameters and conditions. And the evidence of this is as follows. We know that Hifzun Nasl is one of the maqasid of Sharia, safeguarding progeny, and this can only be achieved by marriage normally, in which the natural sexual intercourse occurs between a man and a woman, right? If some reason it's not possible, uh, then recourse may be taken to intrauterine insemination to achieve this important objective, right? And this artificial technique of insemination is analogous to natural fertilization, because what they have in common is the desire to obtain offspring by halal means, right? So Bayas suggests that it is just like normal sex. The highest goal of any marital relationship is reproduction, by which the human species is preserved. And the Prophet has not encouraged having many children, as he said, تزوجوا الودود الولود فإني مكافر بكم الأمم. Marry loving fertile women, for I shall outnumber other nations by being few on judgment day. And so if this maqsad is not being achieved naturally, and there is another possible halal method to achieve it, then one should strive to do so as well. The fuqaha have mentioned that pregnancy in humans can be achieved through other than sexual intercourse, right? From process what they call istinkhal, which is the insertion of the husband's semen into the wife's vagina by the wife herself using her finger or a piece of cotton. So if by this way she inseminates herself, about information from such leaders have ruled that if pregnancy results, then the paternity of the husband is legally recognized, and the wife will have to marry if all divorce for them. Although it's sexual intercourse, uh, she inseminated herself by her husband's semen, recognized the legitimacy of this entire operation. And as you can see, intrauterine insemination kind of actually looks like exactly that. It's just like this in the fall. In fact, you might even say that this is a modern form of fall. Now, what conditions of permissibility for this operation? Well, the law has stipulated in order for this procedure to be permissible that the man from whom the sperm is taken and the woman in whom it is being inserted are completely united in legitimate marriage. So the biggest problem with sperm banks is they both like to it. And most of the time they will not be married. Number two, the procedure should be carried out by the mutual consent of both spouses. There's a friendly debate possible on this because in this uh, so the operation, obviously in medical environment you need consent, that's a different story. But Sharan speaking, uh, would it be halal or haram? Hard to say impermissible, but obviously it's not appropriate to do so without the husband's permission. But if the wife somehow acquires it in semen and she goes to the clinic and does so, the shara ahkam will be applied in terms of lineage, etc. Condition number three, all necessary precautions must be taken to prevent the husband's semen from becoming mixed with someone else's semen at every stage of the process so as to prevent the confusion of lineages. That's again another problem with sperm banks is that when you have an entire place specified for this procedure, the chances of such a problem rise. How do you prevent from this from happening? The procedure must be conducted without delay after obtaining the semen, number one, in the presence of the husband, number two, and the surplus semen must be discarded. Also, the procedure should be performed in a government medical institution under the supervision of a number of reliable and trusted Muslim doctors. Condition number four, there must be a medical indication for this procedure. So it is not permissible to resort to this method except in the case of utmost necessity or dire need after exhausting all other means of infertility treatment. Because obviously this involves other people. First of all, this is going to involve taking out the semen from the husband, which, might be done, most probably is going to be done through masturbation. If not, it will be extracted directly from him using an injection, if that's possible. Okay. Second of all, if the husband is not a doctor, someone else is going to insert it into uh, the wife's womb. So exposing the aura, exposing the satar, it's not permissible in normal circumstances. So this treatment is only allowed when you have no other means because there's some haram that's going on there. And it will only become halal when a need or necessity is established. Either. Condition number five, physicians must fully be sure that this procedure will not cause any physical or mental harm to the mother, nor the fetus after the birth. So do the PGS and everything else that needs to be done before going through this procedure. And number six, there should be no violation of any Islamic regulations, such as for a male doctor to be alone with a woman who is to be inseminated, or for the aura to be exposed more than necessary. Wallahu a'lam bissawab. So this is one example of artificial insemination, the intrauterine fertilization. Next, we have in vitro fertilization. So the previous procedure was all this was happening inside the woman's body. In this procedure, in vitro fertilization, the sperm fertilizes the ovum outside the human body. You know what we call a test tube? So the sperm fertilizes the ovum, the egg, in a glass outside the human body. And there's several possible scenarios for this technique, depending on the identity of the parties involved. So one example is the husband's semen and the wife's ovum are extracted, fertilized externally, and then the fertilized ovum is implanted into the wife's uterus. This scenario is permissible based on the following evidence that the offspring is a gift from Allah subhanahu wa ta'ala and He has bestowed it upon the best of His creation, that is the messengers. And He has made them seem good and lovable to people. زُيِّنَ لِلنَّاسِ حُبُّ الشَّهَوَاتِ مِنَ النِّسَاءِ وَالْبَنِينَ. Beautified for people is the love which they have is for women, for sons, children. Since it is permissible to enjoy the blessings of Allah, and so when something prevents this enjoyment, it is allowed to remove this obstacle. And again, it's not just an enjoyment. This is fulfilling one of the bigger objectives of Sharia. Similarly, if there's a means for attaining one of the blessings of Allah, there's no objection to pursuing it. Again, because this is one of the objectives of Sharia. For normal blessings, one should not be too much adamant in pursuing them, as this leads to heedlessness. So, in vitro fertilization is a means for attaining the blessing of offspring, and hence it is permissible to carry it out between spouses with the condition that you've exhausted all other means. The second is that in vitro fertilization is analogous to natural fertilization. Both are means to obtain legitimate offspring, right? In natural fertilization, the husband's sperm fertilizes the wife's egg. And in this external fertilization, same thing is happening. The only difference is one happened through sexual intercourse, the other is happening in a petri dish. Third piece of evidence is that infertility is either congenital or arising from a condition that occurs afterwards, right? It is permissible to treat a congenital defect that impedes the attainment of reproductive on marriage, as the fuqaha mentioned. They have allowed medical intervention in cases of vaginal, how to pronounce this, atresia or vaginal agenesis and imperforate hymens. Now you must be thinking, what are these things? Right? So these are diseases that actually prevent proper intercourse to take place, and so this kind of prevents um, pregnancy from taking place, right? So vaginal atresia or imperforate hymens is like the hymen or the way to the vagina is blocked off. Uh, Either it is shut or there is a piece of flesh that is blocking it. The point is that insemination cannot take place, so it is allowed to have surgery or medical intervention to correct the situation. As for non-congenital infertility, we've already discussed how Islam urges people to seek medical treatment. So, treating infertility is permissible, and in vitro fertilization is one of the methods that uses the sperm and ovum of a married couple. So, this would be permissible. What again? There are conditions. What are those conditions? Uh, Number one, it is not allowed to use any biological elements from a person other than the husband and the wife. Number two, the procedure must be conducted while the man and woman are still married to each other. It is not permissible to use the husband's stored semen to perform it after the death of the husband or after divorce. Okay? The sperm from man other than the husband is used to fertilize the wife's ovum. Then the fertilized ovum then implanted in the wife's uterus. So this is a second scenario of external fertilization. Third scenario, the sperm of the husband and the ovum of the wife are fertilized externally, and the fertilized ovum is implanted in the uterus of a woman who has volunteered for this purpose, surrogacy. The fourth scenario is the sperm of a third party man is used to fertilize the ovum of a fourth party woman, so they're both ajnabi. Then the fertilized ovum then implanted in the uterus of the infertile married woman. The fifth scenario is the sperm of the husband is used to fertilize the ovum of a woman other than his wife, and then the fertilized ovum is implanted in his wife's uterus. And the last scenario is the sperm of the husband is used to fertilize the ovum of his wife, and then the fertilized ovum is implanted in the uterus of his other wife. From methods B to F, except for the first one that we mentioned, all of these others are absolutely prohibited, either intrinsically because the gametes of someone other than the married couple are being used, or because they lead to confusion of their consequences of lineage, loss of paternity, and other objection elements. The evidence for all of these procedures being impermissible are as follows. Allah subhanahu wa ta'ala mentions, وَعَلَى الْمَوْلُودِ لَهُ رِزْقُهُنَّ وَكِسْوَتُهُنَّ بِالْمَعْرُوفِ. Upon the father is the mother's provision and their clothing according to what is acceptable. So this indicates that the biological father is the man whose sperm is being used and child was conceived is the rightful owner of paternity, and hence scenarios B to F in vitro fertilization are in conflict with the Quranic understanding of fatherhood, since they involve mixed lineage. Allah subhanahu wa ta'ala also mentions, and those who guard their private parts except from their wives. These verse contains the commandment of protecting the genitals from other than one's spouses. And this is interpreted in the absolute sense and therefore includes protecting them from being seen or touched by others, as well as making sure that the man's sperm does not enter anyone other than his wife. Also, these flares are in essence equivalent to zina because both lead to the same result of inserting the semen of a man into the uterus of a woman to whom he is not legally married. Since zina is prohibited, these flares likewise will be prohibited. Also, there's in the hadith in Bukhari which mentions nikah al-jahiliyyah, and also in Sunan Abi Dawud, in which the Prophet Islam mentions some of the ways in which nikah was conducted in jahiliyyah. And among those methods, uh, was a procedure what the mushrikeen of Makkah used to do was sometimes a man would send his wife to another person to get impregnated by him. Why? Because that person was considered of a better lineage of having certain qualities and skills that the husband lacked. And so this couple wanted their children to have like that, those skills, those qualities, those high lineage. And so what he would do is would send his wife uh, to be impregnated by the other person. This was one of the nikah of Jahiliyyah. The other was that multiple men would come to a woman, would have intercourse with her, and then she would select who is the father amongst them, arbitrarily. Another form of nikah of Jahiliyyah that the Prophet ﷺ mentioned is that they would bring a qayafa, would then judge who the father should be, but the woman would have been inseminated by multiple men, right? So he mentioned different types of nikahs, and I mentioned that all of those are made haram, except for one type of nikah, that which we still do today. That was also prevalent there in the Jahiliyyah. That was sanctioned by the Sharia, approved, and so we have it today. All the other forms of nikah, they have been disbanded. And as you can see that all of these examples kind of like fit in one of those nikah of Jahiliyyah, and they have been made forbidden by Allah subhanahu wa ta'ala. Allahu a'lam. Wassalam.